Ladies and gentlemen, thank you for standing by. Welcome to the Health for a Change webinar. During the presentation, all participants will be in listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, May 27, 2015. I would now like to hand the call over to Ms. Erica Bender-Wooten. Please go ahead, ma'am.
Thank you, Kayla. Good afternoon. This is Erica Bender-Wooten. I'm the Senior Program Officer for the Foundation for a Healthy Kentucky. Thank you all for joining the webinar today. This webinar is part of the Foundation's Health for a Change training series. This free series is comprised of webinars and in-person workshops designed to support the efforts of Kentucky's community health coalitions, agencies, health advocates, and other interested community members. I'd like to begin today's webinar with a brief introduction to the Foundation. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet healthcare needs of Kentuckians. The Foundation currently has two main focus areas: promoting responsive health policy, which aims to make public policy more responsive to the health and healthcare needs of the people of Kentucky, and investing in Kentucky's future, which aims to improve the health of Kentucky's children by engaging communities in testing innovative strategies. The Foundation fulfills its mission through a variety of activities, which include grant-making, supporting targeted research, convening key stakeholders, providing policymakers with the information needed to make decisions which impact the health of Kentuckians, and by offering training and technical assistance through events such as this one. Next, I want to direct you to the Foundation's website, healthy-ky.org. There you will find archives of past Health for a Change webinars, Foundation reports and issue briefs, and an upcoming event schedule. Today, we are going to hear from Attica Scott, Community Coach with County Health Rankings and Roadmaps. She has a great presentation planned for you. As the moderator mentioned, all participant lines are muted, but you may submit questions via the chat feature. There will be a Q&A session at the end of Attica's presentation, and Attica's slides and the recorded webinar will be available on our website within a few days. Before I turn things over to Attica, I'd like to provide you with a brief introduction. Attica is quite accomplished. Before coming to County Health Rankings and Roadmaps, she served on the Louisville Metro Council from 2011 to 2014. She also served as an adjunct faculty at Jefferson Community and Technical College and Bellarmine University. Attica holds an undergraduate degree in political science from Knoxville College and a graduate degree in communications from the University of Tennessee. She is a certified anti-racism trainer through Crossroads Ministry and the Commission on Religion in Appalachia. Her proudest accomplishment is being a mom to advocate in Ashanti. Welcome, Attica. We're honored to have you today.
Thank you so much, Erica. I appreciate that generous introduction and the opportunity to share some of the good work at County Health Rankings and Roadmaps, and in particular, our community coaching program. I appreciate the staff of the Foundation for a Healthy Kentucky for the invitation to be here today. County Health Rankings and Roadmaps is a program that is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We have 4 regionally based coaches in Madison, Wisconsin, which is the home of County Health Rankings and Roadmaps Action Center, and we have 7 community coaches who are working across the country. Our 10 guiding principles for our work are based on harnessing the collective power of community members and leaders from multiple sectors, using data from the county health rankings and local sources to identify needs, set priorities, and track progress, focusing action on all of the factors that influence health, especially those that contribute the most, such as social and economic factors, recognizing and building on assets to chart the community's unique course toward a shared vision of health, putting health within everyone's reach by addressing gaps that disproportionately and negatively affect certain populations, using evidence where it exists to guide the work, and where evidence is lacking, creating new and innovative solutions, and committing to sustainable change that focuses on systems, policies, and environmental solutions, securing and making the most of resources, including fully leveraging human capital and considering health impacts in public and private decision-making, measuring and sharing progress and results widely and using these results to continuously improve health, and contributing to a national movement to create a culture of health by sharing stories and lessons learned. During today's webinar, I will provide you with a very brief overview of County Health Rankings and Roadmaps, our community coaching program, and of course, answer your questions about our work. So before we get started with our overview of County Health Rankings and Roadmaps, I would like to get a sense about your familiarity with County Health Rankings and Roadmaps. So I ask that you please respond to the polling statements above, and I'll give you a couple of minutes to respond. I'm going to close the poll in about 40 seconds. And I'm going to go ahead and close the poll. So let's see the results. So that's one of the reasons why I'm here today. 44.2% of you have never heard of the County Health Rankings and Roadmaps, so this webinar is an educational opportunity. 27.9% of you are familiar with the rankings, but not necessarily the roadmaps. 16.3% of you are familiar with both, and 14% use them in your work. So that is definitely something that I'm glad to see. So for those of you who have never heard of us, here's your opportunity. So I like to start with a definition of health disparities because creating a culture of health requires us to have a shared understanding of health disparities. So you see these two definitions in front of you. Health disparities refer to differences between groups of people. These differences can affect how frequently a disease affects a group, how many people get sick, or how often the disease causes death. The term health disparities refers to population-specific differences in the presence of disease, health outcomes, quality of health care, and access to health care services that exist across racial and ethnic groups. And what I want to make sure that you do is note that the National Institutes of Health goes on to cite racial and ethnic minorities, rural areas, women, children, elderly, and people with disabilities in its definition of health disparities. And I'm going to ask Erica if she can chat out in the chat window a link to that additional definition. And you'll see that in the chat window. Thank you so much for that, Erica. In order for us to overcome health disparities, we need to understand and work toward health equity. So I must definitely give a shout out to the Foundation for a Healthy Kentucky on its really awesome webinar on health equity in Kentucky from February 2014 that was led by their own Gabriela Alcalde. And I'll share this definition to make sure that we are on the same page during this presentation. Health equity is the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities historical and contemporary injustices, and the elimination of health and healthcare disparities. So what does health equity look like in action? We will take a look at the County Health Rankings and Roadmaps website in a moment to share some examples of policies and programs that work. But before we do that, I want us to listen to what health disparities sound like in real life. So here's a really short audio clip titled "Place Matters" by Clint Smith.
As a child, my father would tell me stories of ancient Egyptian warriors traveling for endless days and nights across infinite desert plains, showing signs of endurance and bravery I could only dream of emulating. He would tell me that upon their return home, these warriors would be welcomed with a feast worthy of their bravery on the battlefield. Years later, as a teacher in Greater Washington, D.C., I too now find myself traversing a desert, though it is not the one I envisioned. A food desert. It's categorized as a poor urban area where residents cannot afford or are not given access to healthy foods and grocery stores. Every day at 2:45, I watch my students hop onto this leaking submarine of a school bus, every block bringing them deeper into an ocean where the only fish they find are fried, where fruits and vegetables just can't be found because there are no grocery stores here. Just liquor stores and Popeyes, Dunkin' Donuts and 7-Eleven's. Children born into a neighborhood that feels more pollution than solution. It is then I realize that I am not too far from the deserts I once dreamed of. See, whether Anacostia or the Sahara, it doesn't make much difference because to Whole Foods, Southeast DC is no different than the Serengeti. To them, brown-skinned little boys like my students are nothing more than walking cacti, just a piece of scenery this world has taught everyone to stay away from. Brianna literally has a landfill in her backyard, so she has a hard time convincing herself the world doesn't just think she's trash. Restaurants come and dump the remains of food she'll never be able to afford to eat 3 steps from her back door. Jose eats fast food 5 days a week because his mother works 3 jobs to take care of 6 kids and only sees her son when she arrives home from work at the same time he's leaving for school. He has gotten so big that the excess fat bunkered beneath his skin puts added pressure on his joints. His knees are literally crumbling under the weight of this world. Olivia watched her father shot 2 feet from her front porch. She wants nothing more than to go outside and play at the park after school, but gun violence has made a merry-go-round feel more like Russian roulette, so she doesn't go outside. Simply eats any processed food from the cabinet that will last long enough to prevent her from leaving the house too often. These are my students, my warriors, fighting a battle against an enemy they cannot clearly see. These kings and queens meant to feast, not to fester, but their zip code has already told them that their life expectancies are 30 years shorter than the county 7 miles away. I can see the faults of my own ancestry shaking in their eyes. Diabetes and high blood pressure run through the roots of my family tree. Heart disease is as much a part of my history as shackles and segregation. So from my father's kidney transplant to Olivia's asthma, these things are more than mere coincidence. Both grew up in places more accustomed to gunshots than gardens, so tell me place doesn't matter. Like the neighborhoods that are predominantly healthy aren't the same ones that are predominantly wealthy, because when you're not choosing between buying your medicine and your groceries, health doesn't have to be a luxury, doesn't have to be an abstract concept presented in academic journals and policy briefs. My students overcome more every day than I will in my lifetime. They are the roses that grew from the concrete, the budding oasis in the heart of the desert, and their lives are worth far much more than the things that this world has fed.
Wow, what powerful commentary from Clint Smith on health disparities and how our children are much more valuable than the health inequities that some experience on a daily basis. So what are some of the factors that affect our health? As we continue with the theme of place matters, I appreciate this slide that my colleague, Raquel, often shares with communities. If you have heard of Humans of New York, that means that you have probably visited the Humans of New York Facebook page and blog created by Brandon Stanton to document the everyday lives of working people. And I have asked Erica if she would chat out the link to the Humans of New York website so that you can look up some of these examples for yourself. So on the left is a young man from the Bronx, New York, which was ranked last in the county health rankings this year. And his quote says, "When you live here, you don't have too many fears. You've seen pretty much everything that life can throw at you. When I was 9, I saw a guy get pushed off the roof of that building right there." Whew, pretty heavy. And on the right is someone who speaks to the issue of jobs. They started firing people. "I think my time is coming soon. Once you build the pyramids for them, they want to run the pyramids as cheaply as possible." Hopefully, we can all agree that all people should have the opportunity to live a long, healthy life, regardless of their age, income, education, or ethnic background. And that is why, as it relates to jobs, cities like Louisville passed minimum wage increase legislation in 2014, and Lexington is currently considering minimum wage legislation for action in 2015. So let's look at the County Health Rankings and Roadmaps logic model. This slide shows our thinking about how the rankings can be used to improve the health of a community. We start with population-based data from a variety of sources. Then we use that data to rank the health of nearly every county in every state. We released the 2015 County Health Rankings in March, which attracted a lot of media attention. And some of you may have read stories in your local media about how your county compares to others in Kentucky. For example, Kentucky was featured in the USA Today on the day of our rankings release in March. You can use the report to get the word out to your local media and others about the rankings, using the report as a call to action. And in a moment, I will show you an example of such a story. This call to action is intended to help community leaders bring together people from a variety of sectors to look further at communities' needs. We are fortunate in Kentucky to have a fantastic state team leader in Dr. Sarah Janine Kanotra of Kentucky Behavioral Risk Factor Surveillance, based in Frankfurt. Some of you may recall the webinar that Dr. Kanotra led for the foundation back in May 2013. Community members identify evidence-informed policies and programs that can be implemented locally. For example, the Kentucky Special Project is using our health rankings as a call to action to help address policy supports for children of incarcerated parents. As a result, ultimately, the health of the community improves. So again, county health rankings are a call to action. The horizontal portion of our model underpins the rankings. The county health rankings help communities understand what is making them healthy or sick and serves as that call to action. The vertical portion of our model underpins the roadmaps. The County Health Rankings roadmaps help communities take action to become healthier places to live, learn, work, and play. So let's start with the rankings. For each county, you will find 2 rankings, one for health outcomes, which are today's health, and one for health factors, which are tomorrow's health. So if we walk through the model starting from the bottom, we believe that effective local, state, and federal policies and programs, which you'll see with the orange box, can improve a variety of factors that, in turn, shape the health of communities. In a moment, we will take a look at the Kentucky Youth Advocates' work to address income inequality. Many health factors, the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure 2 types of health outcomes, which are the green boxes, to show how healthy each county is by length of life and quality of life. For example, a clean indoor air policy is a policy that can influence health factors, such as tobacco use, which we know about in Kentucky for sure, which in turn influences health outcomes. We often point to this image as one of our most important because it outlines what we use to determine the county health rankings and what influences health in a community. Many of you on this webinar are quite familiar with the social determinants of health, so our rankings might be familiar to you. We know that much of what affects our health happens beyond medical care, and because of that, the rankings underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure that our kids grow up healthy are top priorities. So let's take a look at our action cycle, which is the how within rankings and roadmaps. It lays out the process communities follow to improve health. Communities use the action cycle to gather information to assess needs and resources, to set priorities so that you can focus on what's important, to find the most effective approaches to address your priorities, and then to get to work on acting on what's important. And of course, evaluating throughout the cycle, which helps you to improve your strategies and ensures that what you are doing is effective. You will see that communicate and work together sit outside of the cycle because working together and communicating with stakeholders is essential throughout the Take Action cycle. At the heart of the Take Action cycle is people working together because we know that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. The Roadmaps to Health Action Center includes guidance and tools to help communities keep moving along this cycle. And I'll show you some examples on our website, but first I'll ask that Erica chat out our Action Center link. Thank you, Erica. So we know that there are many approaches that communities can take in order to address challenging health issues in their area. We will spend the next few minutes looking at how we use data to move toward action. So welcome to our new website. County Health Rankings and Roadmaps provide an annual snapshot of health in nearly every county in the country. You can find your county and its rank by typing in your county or state at the top in order to get started. Communities across the United States are using the rankings data as a way to address gaps and to improve health. So I'm going to share with you my desktop so that you can see me walk through the website. So I grew up in Kentucky. I was born in Louisville, and most of my family lives in Louisville. So I'm deeply honored and humbled to be part of this important community health work and to be a community coach that is based in our state. So if you click on Kentucky from the home page, one of the reasons why I'm so honored to do this work is because I know that Kentucky has a lot of really good assets and we have some work to do. So clicking on Kentucky from the home page map will take you to the Health Rankings drop-down menu. If you click on the Kentucky Summary Report from the Overview tab, which you can either click on Kentucky or you can go to a particular county if you wanted to on the map. But what you will find is that there are key findings for Kentucky, which you can find via a search, or you can scroll down to the bottom of this page and click on the Kentucky Summary Data, which gives you a summary of Kentucky's findings. So what I want to do is scroll back up to the top, and I want to click on Frankfort or Franklin County on the map, which will take you to the Rankings tab. And so let's take a look at our state capital and its county snapshot. In the first column, you will find over 35 measures. In 2015, this year, we added one new measure, income inequality, because we know that both the average level of income in a county is important, as well as the distribution of that income among households in a county. So how do you know what areas to explore? So if you click here on Areas to Explore and click on, you'll see that it highlights potential challenges a community may want to examine more closely. When you turn on this feature, orange boxes will highlight areas to explore based on health factor measures that seem to have the greatest potential opportunity for improvement based on the following: measures where there are meaningful differences between a county's values and the state average, the top U.S. performers, or the state average in the healthiest state. As with a county's ranks, these areas to explore are one starting point to consider in the journey toward improving health in your community. Also notice that you can click on Compare Counties if you wanted to compare the counties, so that's at the top next to Select a County. And you can do that to see the differences from one county to another. Frankfort, or Franklin County, like a number of our counties, could choose to explore adult obesity, since it is getting worse for this measure. So remember that image earlier about culture and health. In order to get to the additional measures for adult obesity, you can click on adult obesity, and you will then be on the measures tab, as you will see at the top of the Kentucky landing page. So you see that measures is highlighted, and it's loading the measures. And we'll give it a moment to load the measures. If you click on the down arrow in the box that reads Health Factors, you will see three options: Health Outcomes, Health Factors, and Additional Measures. You can then click Health Behaviors, and then on the measure you want to review, which we're looking at adult obesity. So, okay, that is an overview of the measures we use, but the rankings data is a starting point. So let's go back and click on Kentucky. You'll see the health outcomes map on the left side and the health factors map on the right side. Both maps show how the counties in Kentucky compare to each other. And that blue for health factors, folks, in case you're wondering, it's the same blue for every state. No athletic or political statement here, I'm just saying. So remember that health outcomes are in green. That's today's health, which includes length of life and quality of life. Health factors are in blue, which are tomorrow's health, which includes health behaviors, clinical care, social and economic factors, and physical environment. And here's the answer to the question: what do the different shades of blue and green even mean? Well, on both maps, the lightest shaded counties are healthier and the darkest shaded counties are less healthy. If you're interested in learning more about any particular county, you can click on it to see more data behind the rank. So let me click back on Franklin County. So on the far right, we see the two overall ranks: health outcomes, today's health, and health factors, tomorrow's health. We see that Franklin County ranks 32nd out of 120 counties for health outcomes and 32nd for health factors. Like many places, Franklin County has some work to do in order to address its challenges and build on its strengths. We know that Franklin County Health Department is leading the way in building a culture of health in Franklin and Frankfort. In 2010, the Franklin County Public Schools passed a 100% tobacco-free school policy, which makes absolute sense when you look at the data and see that 28% of the adult population in Franklin County smokes, compared to 26% in the state overall. So, okay, back to the county snapshot, which contains 4 columns of data. This time we can take a look at, let's say, Floyd County. So we can actually click on the down arrow under Select County and scroll to Floyd County, or we could type in Floyd. And click on Floyd. So Floyd County, as you know, is in eastern Kentucky, and I'm looking at the trend column where we see that Floyd County is getting better as it relates to the diabetic monitoring measure. Why? Because the health department started an education and treatment program for people with diabetes or at risk of being diagnosed with diabetes who were uninsured, and the school system began a diabetes testing program for 5th grade students going into 6th grade, and the Big Sandy Healthcare began a pre-screening program that has been successful in identifying diabetes in folks who were unaware of their status. So next you will see the error margin. We use a 95% confidence interval. Basically, this means that we are 95% sure that the actual number for your county is the given range. In the 4th column, you will find top U.S. performers. This is the 10th percentile for measures we are trying to decrease, such as smoking rates, or the 90th percentile for measures we are trying to increase, such as high school graduation rates. It is included as an aspirational value, which means that only 10% of counties in the nation do better than the given number. So finally, you will see the state column. This allows you to compare your county's numbers to those of Kentucky overall. So this was a quick look at the data you will find on your county snapshot. And you can learn more about interpreting your rankings data using your snapshot. You can find more data in using the rankings data section of our website. Our Finding More Data page may be particularly useful for folks. And there's the additional measures tab. But the More Data page may be useful in finding data for more granular geographic levels like census tract or zip code. And you can also find links to additional data resources in your state. You can also find this section on our County Health Roadmaps page. So remember, ranks are great for garnering attention, simplifying a lot of complex data, and making comparisons between one county and another at a point in time. But they should not be used alone to measure a single community's progress. Rather, look at them as one tool among many. So, okay, now we can take a quick look at the roadmaps. So I'll scroll up to the roadmaps to health, and I'll click on the Action Center. And here's an example of our Action Center and one of our guides for these steps in the Action Center, which I will take a look at. Act on what's important. As you can see, it includes who to involve, it includes key activities, specific activities with excellent tools and resources, which are in the blue boxes. And then there are links to guides for specific community members on the left. And one example of Act on what's important, as I mentioned before, is Kentucky Youth Advocates. So if you search for Kentucky Youth Advocates, first you need to know how to type. Then we can click on one of these links, and I'll click on the one that says KYA pursues EITC to help children and families. And when we do that, what we see is that Kentucky Youth Advocates, in coalition with a list of partners, and so that you can better see that, I will scroll down. And in partnership with those partners, Kentucky Youth Advocates was acting on income inequality because health and wealth are connected. And you can read the key findings report for data on poverty rates in Kentucky, particularly among children. And I'll talk more about this particular project with Kentucky Youth Advocates in a moment when I talk about our coaching process. So be sure to visit What Works for Health, as it is an easy-to-use searchable menu of solutions for the specific issues that you are addressing. And if I go back up to the roadmaps to health and click on What Works for Health, you'll see what I'm talking about. It includes evidence ratings, literature summaries, and implementation resources for over 325 strategies. So you simply select a health factor of interest. It could be tobacco use, employment, access to health care, environmental quality, and you browse through the listings for ideas of strategies that your community could use to address the health factors of interest to you. And so I'm going to talk about our community coaching, but what I wanted you to know is that on every single one of our pages, there's this orange button that says Contact Us. So that's how you can reach us if you want more information. So, okay, that is a very brief overview of our dynamic website. Now let me share with you what we do as community coaches to support you in building a culture of health in the places that matter the most to you. So remember, I talked about an example of how Kentucky has used the rankings to garner media attention. So you'll see where the Courier-Journal did an article about Oldham County, which was near the top in Kentucky for county health rankings. And I mentioned before that Kentucky was featured on the day of our rankings release in March in the USA Today. So let me see how you think the rankings might be helpful to you. So if you would respond to these poll questions about whether you've used the rankings or not, it doesn't matter. The questions are about how the data might be helpful in your work. So if you would respond to whether or not they would help to create a sense of urgency in conversations with others, or you could use them as evidence in supporting priorities, or you could use them to build a case for action or to raise awareness with elected officials, I'll give you a few minutes to respond. I'll give you about 15 more seconds to respond, and then I'm going to close the poll. All right, so let's see what you all said. How might the rankings be helpful? Wow, 81.6% of you build a case for action, 57.9% to raise awareness, 55.3% to use as evidence, and 34.2% to create urgency in conversation. All of the above are exactly right, ways in which you can use the rankings. So I'm going to talk about that a little bit more. So community coaching is one programmatic area that can directly support your use of our data. A coach is a guide on the side. It's someone who is at your side, who's able to see the big picture, to offer encouragement, to ask questions that will help you steer your course skillfully. So I think about just about every morning of the week, I take a walk on the Big Four Bridge here in Louisville. And in the morning, I am able to stop and pause and watch the University of Louisville's women's rowing team practicing. And they have a guide, another person in another boat who is just guiding their path. But it's the team, it's the individuals who are doing the synchronized rowing that are reaching their goal together. That's what a coach is. That's what a coach does. So in other words, we invite community members to explore ideas and to raise questions and to use the resources and tools that we have available on our website versus telling you what to do, because really the expertise is already in community. Roadmaps to Health Coaching offers community leaders the opportunity to strengthen or rejuvenate multi-sector partnerships so that they are better able and poised to advance their work that builds a culture of health, to enhance community capacity in at least one area in what we call our Poised for Progress tool, which is a self-assessment of the critical skills necessary to create health in communities, to build direction, alignment, and commitment to implement and to sustain specific strategies to enhance health outcomes, and to connect with other community leaders or national experts who are building a culture of health. So when I talked about Kentucky Youth Advocates, we used a similar process when I coached them from 2013 through 14 as part of the Robert Wood Johnson Foundation's coaching program. So we followed this process. We connected with introductory calls. And with communities that my coaching colleagues and I across the country work with, after those introductory calls, we often will send you out an application. And then we engage with you with coaching kickoff calls, some real formal goal setting for both the coaching relationship and the work that you want to do in community. And then we work with you to get to know our Action Center. And then we guide you with the monthly coaching calls. Because our coaching is virtual, we do monthly coaching calls to guide you through your work. And then we're doing evaluation of our work throughout. So we have a pre-coaching survey, we have an interim survey, and then we have a survey at the end. And midway through the coaching process, we might do a site visit. It's optional. It's an opportunity for a community to share some of the good work that they're doing, or to ask us as a coach to come in and facilitate a conversation on something like boundary-spanning leadership or collective impact or health equity. And then we work through transformation toward the end, which is what I did with Kentucky Youth Advocates, which is to close out in our final calls the coaching relationship and to do a final survey and summative report so that they are able to then independently continue the work that they need to do on their own. So that's how our coaching process works, and I'd be more than happy at the end to answer any questions that you may have as it relates to a little bit more detail and information on coaching. So why should communities invest time in coaching? And this is a picture of our Poised for Progress document that I just referenced. Coaching is about building community confidence and becoming more strategically focused and being accountable to goals and actions and building your reflective muscle and developing local capacity for change and learning and improvement and innovation. So the bottom line is it's about developing your local capacity. We as coaches are showing teams how to fish rather than giving you the fish. So we have a wonderful group of coaches across the country, as I mentioned, who are teaching folks how to fish or working with folks on how to fish. And here are our 11 coaches, and they come from a variety of disciplines, from public health to education to social work to law to urban planning. And they have worked in a variety of settings, from local foundations to advocacy organizations to hospitals to public health departments to city councils. And they live, as I mentioned, all around the country. So I am confident that there is a good match for your community among our stellar coaches. So, for example, if you're interested in connecting art and community health, or health and art, we have a coach with that expertise. Or if you're interested in community health and health equity, we have coaches with that expertise. And if you're interested in community health and public policy, we have a coach with that level of expertise. So you will be able to find a coach to meet your community's needs. I'm confident of that. So one of the really amazing pieces of work that the Robert Wood Johnson Foundation does is its Culture of Health Prize, which, if you take a look at their criteria, they really do reflect our 10 principles that I mentioned early on in the webinar. The Robert Wood Johnson Foundation's Culture of Health Prize honors communities whose efforts illustrate an enduring commitment toward creating a culture of health for all residents. And winning communities receive a $25,000 cash prize. And again, as I said, those criteria that they use reflect our principles. And I can talk to you some more during the Q&A about some of the communities and the work that they have done. But I want to make sure I leave plenty of time for your questions. So we're almost to the question point, so get ready for your questions. We're about 3 slides out. So here are what I think may be some helpful guide and reflection questions for you. Who else do you need to share this information with in your community? What is one idea for action that you are taking away from this webinar? What else do you need to know to take action and to use this information? So I want to leave you with some ways in which you can contact us. You can use social media to stay in touch with and to communicate about the county health rankings and roadmaps. You can subscribe to our e-newsletter. Here's the email address that's available for you to subscribe to our e-news, which we send out maybe once every couple of weeks because we're very respectful of your email inboxes. You can, of course, like us on Facebook, and you can follow us on Twitter. And as you can imagine, this program is the result of the contributions of many partners, including those listed here from the Robert Wood Johnson Foundation, the Wisconsin County Health Rankings and Roadmaps team, and our additional partners. Whew, folks, that was a lot to cover in about 40 minutes, so now it's your turn. So I'm interested to know, what questions do you have for me about our work at County Health Rankings and Roadmaps?
Thank you, Attica. That was an excellent presentation. To all of our participants, I would like to remind you to please use the chat feature to submit any questions you may have at this time. Okay, Attica, it looks like we have our first question. Should I focus only on low rankings in my community?
Actually, you should focus on both the high and the low rankings because you want to have a broad picture of health in your community, and you want to make sure that you're responding to what people in your community have said is important to them. So even if you have a ranking that is high this year, it may have been something that was an issue in previous years. So you want to make sure that if it's something that your community wants to focus on, that you're mindful and respectful of that. And I can share with you an example of a community that I'm working with in Mississippi where their rankings improved tremendously around high school graduation. They went from a 39% high school graduation rate to a 56%. And so I asked them, have you used that as an opportunity to celebrate? Because so often we get bogged down in the low rankings that we miss out on the opportunity to celebrate what we're doing well.
Great, thank you. And actually, I have a question that's directed at me. Yes, the slides and the recording of the webinar will be available within a few days. We'll email those out, and they will also be available on the Foundation's website. And then, Attica, I have another question for you. Is there a charge for coaching services?
Excellent question. I am surprised that I overlooked answering that in the presentation. Coaching is at no cost to communities thanks to the generous support of the Robert Wood Johnson Foundation. So good question.
Okay, it looks like we have one more question. Can I request a specific coach for my community?
You may be interested in having a specific coach for your community, but what I will say is that coaching is decided based on a number of factors, including geographic location, including the coach's capacity, how many other communities are they coaching. Also on our content or subject matter expertise. As I mentioned before, if you're interested in something like art and health or public policy or health equity, there may be a coach that's better suited to your community's need than the coach that you might want to request.
Great, thank you. I have another question. What is the average time frame that you may coach a town on a specific topic?
Another good question. So we may do a short-term coaching, which could be 2 or 3 months because you just have something that may not need a longer-term coaching. But our maximum amount of coaching is 12 months. So we definitely end the coaching relationship at 12 months. But as I mentioned with the Kentucky Youth Advocates, we spend the 3 to 4 months leading up to that, transitioning you into an independent community process where the coaching is about to end. So you're setting up your own systems.
Okay, great. And it looks like this one you may have covered in your presentation, but I want to coach for my community. Where do I start?
Another good question. So you can start on the website, on any one of the web pages on any of the landing pages on our website. You will be able to click the orange box that says Contact Us or Take Action, and that will send you to our email address or our contact information sheet in which you're able to put what's your need, what are you wanting some support around, is it a policy, is it a program, is it better understanding the data, is it that you would like to speak to a coach, and make sure that you include your contact information, and then you will get a response usually within 48 hours from a coach.
Great, thank you. There's another question. Is there a cost associated with data interpretation or direction?
No, again, it's just like with our community coaching, because this is a program of the Robert Wood Johnson Foundation, our services are provided to communities at no cost, including data interpretation or direction. And what I'll add to that, Erica, so that people know, is that we often get what are called, quick response questions. It's a rapid response. Somebody just really wants an answer to a data question. And so we're able to respond to that and get you the information that you need, as I mentioned before, usually within 48 hours. And that is no cost to communities.
Great, thank you. Attica, it looks like there are no more questions in the queue. We do still have a few remaining moments. If you have any questions, please chat them in. We'd be happy to answer them for you. And Attica, if you have any last things that you would like to add, please do so.
Well, thank you, Erica. What I will say is that communities have a rich opportunity with coaching to create the kinds of plans that will make a difference in building a culture of health in their communities, to really address some of the sticking point issues that your community may have been struggling with for a while, and just trying to figure out some direction and what kind of policies and programs could make the most difference and have the most impact. So I encourage folks to really think about the community coaching process, which I'm happy to discuss and answer questions about a little bit more in the time that we have left.
Great. Attica, I do have one more question for you. It says, I know you provided examples, but could you give one more of how coaching has helped a community?
Sure. So Focusing on food equity priorities, Joplin, Missouri is a fantastic example of building community capacity through coaching. So Joplin was focusing on food equity priorities and building a more diverse partnership. And as some of you may know, in 2011, what's called an EF5 multiple vortex tornado cut a 1-mile swath through Joplin. And one of the results of that tornado was families experiencing food insecurity. So in response, about 14 organizations representing city government, public health, nonprofits, business, healthcare, and education came together in 2014 to form the Joplin Food Access Network to address the issue. And their first order of business was to complete their first food equity assessment in an area that was covering about 3 school districts and 7 zip codes. And the resulting data painted a picture of food availability and pricing from the perspective of both the consumer and the retailer. So with the support of community coaching and by one of my fabulous colleagues based in Madison, Wisconsin, Jan O'Neill, the Joplin group was able to design a process for prioritizing their issues based on guidance provided in the Focus on What's Important guide in our Roadmaps to Health Action Center, and the First Things First, Prioritizing Health Problems, which is a tool in our Action Center that's from NACCHO, N-A-C-C-H-O, that describes 5 prioritization methods. And before launching into the prioritization process, they developed a high-level guiding question. How can we ensure that all people in our community are healthy? And this question provided a larger context for the prioritization of their work. And so coaching helped Joplin leaders to use tools at a meeting to share the food equity assessment data with stakeholders and additional community members, tools like facilitated brainstorming, multi-voting, and a final vote using a prioritization matrix that included 4 criteria. So what was the value of taking the time to think through a prioritization process? So as one community member commented, it really helped put some flesh on a very daunting task. And another said, I appreciate that my voice has been valued today. So given the magnitude and urgency of the task before Joplin, members felt like the planning time invested thanks to direction or guidance from community coaching was well worth the effort. And I just want folks to know that they can find more of these stories and examples on our website, including stories from Culture of Health Prize winners. And I encourage you all to really look at the Williamson, West Virginia story, since Williamson is a neighbor to our Kentucky border, and it was once a coal community, just like some of our communities in eastern Kentucky.
Great. Thank you, Attica. I do have one more question in the queue. What type of education background does a community health coach have?
Oh, another good question. So our community coaches have all kinds of educational backgrounds. And so, for me, I have an academic background with an undergraduate and graduate degree in different topics, communications, political science, experience working in community. Our coaches have experience with social work and education and law and public health and urban planning. And as I mentioned before, they've worked in a variety of settings, from working with local foundations to advocacy organizations, with public health departments, working with hospitals, having that public policy experience that I've had serving on the Metro Council in Louisville. So they have an extensive educational background, as well as what's also just as important, the experience that's important to coach a community.
Great. Thank you, Attica. I do have 2 more questions, it looks like. Have you worked with any communities on smoking cessation?
Some of our other coaches have, and those stories are, again, on our website. And if I had a little bit more time, I could go to those stories on the website. But if you type in smoking cessation on our website in the search box, those examples will come up for you.
Okay. And how long is the wait to be connected with the coach?
Good question. So your request, if it comes in through that orange got a question, take action, need help button on our website, we'll usually have a response within 48 hours.
Great. And it looks like we have one final question. Perhaps it's a statement. Maybe they're asking you to elaborate, but it says, we have problems with people coming to meetings and staying in the program. Do you have any suggestions?
Sure, and as coaches, we work with communities that have that exact same problem, so you are not alone. And we have tools and resources that we're able to use with communities to really help them work with communities to keep them engaged and keep them connected, to see where there is direction and alignment and commitment so that folks remember why they got involved in the work in the first place, so that it will help to keep them active and engaged throughout the process.
Great. Thank you, Attica. It looks like we are about out of time today. I want to thank you so much for being our speaker, and thank all of you participants. Your questions were great and certainly made the webinar run smoothly. I appreciate it. We would love to have your feedback. You will be receiving an email that has a survey, a post-event survey link in it. Please take the time to fill that out for us. It should only take a few moments, and I can't express to you how valuable it is to us. We are also interested